of the spine to keep the brain alert. Good evening, guests. Good evening, dear friends of Dignity Foundation. Good evening, Dr. Dang. NCR chapter of Dignity Foundation is happy to be back in action. And it is no coincidence that our session today is titled Back in Action. 16th October marks the World Spine Day, and we thought it would be a good time to understand more about our spine and what senior citizens can do before it starts to demand attention through pain or disability. On this occasion, we're extremely honored and privileged to have amongst us Dr. Professor Ramandeep Dang. Let me introduce you to our resource person for today's session. Dr. Dang is a senior endoscopic brain and spinal surgeon with a vast experience in the field of neurosurgery, especially brain and spine disorders. He specializes in minimal invasive and endoscopic craniospinal procedures for ailments like back pain, neck pain, facial pain, disc problems, and spine degenerative disorders. He has rich academic experience and has been a teaching faculty and department head at Punjab State University. Dr. Dang has multiple medical publications and research papers to his credit, and he's also on the advisory and editorial board of medical journals. He's been associated with a number of hospitals in the field of neurosurgery. Before I hand over to Dr. Dang, for the benefit of our guests or first-timers in the audience, I'd like to share a little about Dignity Foundation's Chai Masti program. This program provides a platform for regular social interaction and support network to senior citizens. We regularly organize motivating and informative talks, such as the one that we are attending today. We ensure holistic wellness by engaging senior citizens in structured activities that help our members lead an active and happy life. Anyone in the audience who wishes to become a member of our Chai Masti program can connect with us on our website, Facebook page, Instagram handle, or call us on our senior citizen helpline. The All India helpline number and Delhi NCR chapter helpline numbers are being now posted in the chat. I'd like to make a special request to the audience to stay muted till the end of the talk. You can use the chat box to post your questions, and we'll certainly take up all questions after Dr. Dang's talk. Thank you. I now invite Dr. Dang to the virtual stage. Over to you, Dr. Dang.
Thank you, ma'am. Thank you, audience. Thank you for inviting me over. I'm blessed to have this opportunity. Yes, as you rightly pointed out, Archana ma'am, today is the World Spine Day, 16th of October. But incidentally, today is also the World Anesthesia Day. So I will be failing in my duty if I do not acknowledge the role of anesthetists in the lives of surgeons, because it is the anesthetists who help us perform better and better, and they are our first critic. So apart from World Spine Day, it is the World Anesthesia Day as well. So, but getting back to my core specialty, which is spine, and the topic for today, back in motion. Trust me, friends, when I say that, I'm sure the people in this august audience are way elder to me, but trust me when I say that there is nothing better than motion. As long as we are moving, agile, mobile, on our own, life is a paradise for us. The moment, due to any reason, any age, any zone of our life, when our motion gets limited, that nagging pain or disability or restriction does start to play heavy on our mind. Lack of motion not only affects our body per se, physically, it affects our complete state of health, which includes our mental health as well. The WHO data pertaining to the spine problems is astounding. The data which I'm quoting was supposed to be published, or rather was published in the year 2020, but the impact, the importance of this publication or the data got buried because of the COVID wave that hit. This data said 98% suffer from spine problem at one point of time or the other. 98.1% of us will need a spinal consultation in our lifetime. Most of us, the importance is that most of us will improve with that consultation or maybe a couple of consultations, and we will be back to our normal self. But the gratifying part is we all improve. But if in 12 weeks' time we have not improved completely, we are labeled from acute spinal problem to a chronic spinal problem. That means the problem is going to stay with us for a longer time. And this acute to chronicity at end of 1 year is close to 20%. As we talk, in India, 60% of us will suffer from, or rather suffer from, spinal problems. This discrepancy or disparity in the world data or the WHO published data versus our data is because of nothing else but lack of immaculate or appropriate data accumulation. In India, they say 8% of adults, 8%, or rather 1 every 10 adults will have spinal problems as a chronic problem. Largely, they say that at the age of 40, around 40% of the adults will have one disc problem. Am I audible? At the age of 40, 40% of the people will have one disc problem in their spine or more. As we age, let's say when we touch 80, 80% of us will have multiple disc problems for the spine. My dear friends, this is the gravity of the spinal problem, which prevents us from having a normal motion range. Spine problems are considered as an epidemic globally, rather a pan-epidemic after this WHO data was published in the year 2020. Most of these spine problems are limited to one section of the spine, which is the lower back. Before we jump to the stats for the lower back, let me tell you something about the spine. Our spine starts right here, where the brain, the spine starts right here, where the brain finishes or the skull bone finishes. This is the end of the skull bone, and this entire running of the bony structure down to the lower zone or the tip of the tailbone is all spine. During the course of spine, in the middle zone, the ribs attach and they have a bag where, or a box where our heart and the lungs are stored in safety. When we go down, our tummy and its structures, and when we go down further, our pelvic bones or the hip bones come, and from here where our legs dangle down. In the upper zone, the cervical zone finishes, and behind the rib cage are our shoulder blades or the shoulder girdles from where our hands dangle, and this completes our complete skeletal structure. The spine consists of multiple small bones. These small bones are medically called as the vertebrae. What I hold is one vertebra. These are joined adjoiningly with this soft tissue structure called as the disc. And then there's another vertebra. So there are 33 vertebrae in total, or 33 spinal bones in total. Of these 33 spinal bones, the neck region, or which is medically called as the cervical region, contains 7 bones and 6 intervening discs or the soft tissue, which is responsible for the mobility. The middle zone or the thoracic or the middle back contains 12 bones or 12 vertebrae. The lower back contains 5 bones or 5 vertebrae. The sacrum, older than the lower, the area contains 5, they are fused into one. And the tailbone are 4 small bones fused into one. The agility and the mobility of the spine is because that each vertebra has an intervening soft tissue, which is called as the disc. The disc has an outer perimeter of a fibrous tissue, which contains the soft tissue in between, which is a soft tissue, semi-solid soft tissue, which is called as the nucleus of the disc. It is the nucleus which compresses, expands when we move or when we have motion. The maximum motion of the spine is at the lower back. That is the reason most of the degenerative problems of the spine are found in lower back. And the statistics says that 60% of the spinal problem because of the degenerative or age-related process are affected in the lower back or the lumbar area. The next most important region is the neck, where the mobility or the agility of the human is controlled. So the second most common area affected by the degenerative process, close to 25 to 30%, is the neck area. The middle back, it does not have too much of motion area, so they have much less incidence. The sacrum and the tailbones, they have the least, so they have the least incidence. On contrary, trauma, highest incidence of a cervical cord or a spinal cord injury is in the neck or the cervical area, followed by the middle back, because they're relatively more prone. Another reason why the cervical spine is showing more degenerative processes is because of our excessive bad posture and the constant use of the monitors, like the cell phones. We traditionally like to read this, and when we bend our neck, the neck load multiplies. This is what we these days call as a texting neck. What happens is the head, the jaw, the face, they weigh around 4.2 kgs to 4.5 kgs in a normal individual. When the neck is straight, so the neck is bearing a weight of 4.2 to 4.5 kgs. But as we bend the neck and we go up to 60 degrees when we bend the neck, the weight, this 4.2 kgs is now close to 22 kgs that the neck has to support. So you can imagine what a bad posture can do to your neck, how it can enhance, speeden up the degenerative processes, and without having a trauma or any other morbid condition affecting you or your bones, you actually are signing up for your own degeneration process. Just a small example. We'll touch this in details as we go down in the order, but this was to emphasize what a bad posture can do to your neck and why we are having so many cervical degenerative cases, or simply the cervical spondylitis or cervical cases, so many of the last, and they have significantly increased in the last 2 to 3 years, ever since we are more digital, especially after COVID. Now, coming back to more stats and more information about the spine. How does these problems start? When do they start? You'll be surprised that these problems do not start at 40s, 50s, and 60s, but the baseline or the foundation is laid when we are in our 20s. When we do not treat something right, it will backfire. Be it a relationship, be it a street animal, be it something which we have, a materialistic thing which we have bought from the world for our own use. If we don't keep it right, if we don't treat it right, it will backfire. And so is the case of spine. It is indeed shocking that this degenerative process actually starts at the age of 20 to 25 when we are in the pink of our health. And we are in terms of a denial / neglect for our basic health needs or requirements or assessments. When we do not exercise, when we do not work out, when we do not keep the right posture, we are just accelerating this degenerative process, the seeds for which are sown in our 20s. You will be surprised that low back pain or spinal issues are the single largest cause of reporting of disability or not reporting to work anywhere in the world. The most profound data comes from the US, and hence I'm forced to quote the US data because we are yet to have a substantial Indian data on that. So please allow me to quote the US data here because that is, they possibly are the best data keepers that we have as of today. So in US, it was found that this is the single most important cause of reporting for not wanting to work at workplace or disability at work, as they call it. It was also found to be the third most important cause to visit a doctor. The first being skin problems, the second being joint and bone pains, and third is the spine pains. You will be surprised at the cost the health system has to foot in US because of these spinal problems. The cost of losing the work hours for humans not reporting to work a year per annum is close to 50 billion US dollars. I repeat, 50 billion US dollars. And the treatment cost for alone for the low back pain is another 50 billion US dollars. So if you combine them, it is close to 100 billion US dollars in US alone. I agree, they are more stringent for every small thing. They will run to a doctor, they would want an intervention, blah, blah, blah. But all things said and done, 100 billion US dollars is no way a small amount. It is more than the GDP of most of the countries. So losing 100 billion US dollars just to a small issue, which is treatable, which is preventable, which can be managed, requires more attention. So coming down to the point, what is a degenerative disease? That is the most common cause of a spinal problem. Degenerative means age-related. It is spinal disease is up to like having wrinkles as you add years to your life. It is like having white hair, gray hair as you add years to your life. It is akin to having a cataract as you add years to your life. So this is what is called as the degenerative disc disease. In a normal age group or in a healthy age group under 40, the height of this disc is close to 40% of the adjoining bones. But as we age, this disc height starts shrinking because of age, degenerative process. And as a result, we have this degenerative condition setting in. We have those bony spurs or disc protrusions all coming in and taking over our problems. These spinal issues, they do come with a price. And the biggest price that we pay is our mobility. And that's the reason possibly we are discussing why this back in motion thingy is most important. The low back pain. What are the reasons for this low back pain? Most importantly, I am again and again pointing to low back pain as overall because low back pain is the most important degenerative process in the spine and the most important debilitating factors. So in other words, if you allow me to rephrase, what is the most important cause of this spinal pain leading to disability, leading to lack in motion? If we have to understand, let's classify what is acute spinal problem or spine pain and what is a chronic spine pain. Acute is one incidence that started it. For example, you lifted a weight, you had a back stiffness or neck stiffness, that is an acute spine pain. Chronic, once it has been there for 12 weeks or more, despite appropriate, adequate medical treatment, we call it a chronic. And as I had mentioned earlier, around 20% of the people will have this chronic spine pain after that acute incidence, even after 1 year. What is the reason for these spine pains? The spine pain can be because of multiple reasons. It can be by birth, congenital. If you're likely to have a spine pain at a very early age, even when you are a toddler or a teenager, you could have those spine pains. If you have defective spinal development, for example, the spina bifida, you are likely to have it way early, even under 1 year of problem. If you have injuries, sprains, strains, you can have spine problems. Again, but coming back to the degenerative, if your disc degeneration with age occurs, yes, you will have spine problems. Arthritis, inflammation of the spinal joints will lead to spine problems or the spine pain. If there's a nerve compression, be it because of age, be it because of the bony outpouching of the vertebrae or the spinal bones, or be it because of the disc, the commonest, the disc compressing upon the nerve, we will have these spine pains. Or one bone slipping over the other. Bones are usually like this, but they can slip and have a step like this, and they can cause instability and pain in both the zones. Or you could have trauma, fractures, spinal cord injuries, infections, inflammations, or, and most importantly, in the elderly, osteoporotic problems. What is an osteoporotic problem? As we add years to our life, the density of the bone also goes down. The calcium deposition, the strength of the bone also goes down as a part of the aging process. And this bone is now fragile. It cannot withstand the pressures that it used to, or it could when we were 20s, 30s, and 40s. And it leads to problems much more than what we were facing earlier. Even a simple hop, skip, jump can lead to a compression of these bones because they are fragile, and that is what is called as the osteoporotic issues. Other non-spine issues can also mimic spine problems. For example, your kidney stones, the uterine problems, and the fibromyalgias, the endometriosis, and the tumors of the lower back and the tummy area can all lead to spine problems without actually spine pain-like problems, without them actually being genuine spine problems. What are the risk factors what are the problems which will increase the chances of us having a spine pain? Age. As we add more years, the chances of us having a spine pain is more as compared to 10 years back or 20 years back. Fitness levels. People who do not work out regularly, even if it is a small workout a day, a 20 minutes walk, a mobility exercise, people who do it diligently and regularly every day, trust me, friends, I'm not one of them. Despite knowing it, I'm still not one of them. People like me who do not keep themselves fit by doing some small exercise every day are the ones who are more likely to have spine problems than people who do these small steps every day. Weekend fitness freaks, people who work Monday to Friday, long hours in office, but on Saturday, Sunday, they want to make up for fitness, they are more prone to injuries than people who do not work out, because they overdo things despite not having a peak fitness level, and as a result, their spine is more prone to injury. So do it regularly, even if it is a small bit every day. People who are obese, they are more prone to have spine problems. Then job-related issues or social issues. People who lift heavy weights, they are more prone to spine problems than other people. People who are anxious, anxiety-related issues, they are more likely to have spinal problems because of overdoing things on the wrong way than a regular, stable, healthy person. Smoking and alcohol does not help either. How do we diagnose these spine problems? Some blood tests, which will tell us whether we are deficit in some important vitamins like vitamin D3 and vitamin B12, our liver parameters, our hemoglobin parameters, and so on. Simple X-rays of the affected area, which is affecting us pain or immobility in the spine, will give us an information whether the bony structure is right or not. The conduction studies, the nerve-related studies, which tell us whether the functionality of the nerves and the muscles is appropriate or not. The MRIs and the CT scans, they all help us in diagnosing the spine-related problems and help us back in motion. How do we treat, once we have identified an issue, how do we treat a problem? The first and foremost, like any other problem, is that when you have an acute back pain, you take rest, you do not exert. If your back pain is severe enough to hamper your day-to-day activity, or the back pain is lasting for more than 12-24 hours, despite your home remedies or whatever you have thought of, you must consult a doctor. You must consult a doctor. As a doctor, the first line of therapy is medicine, your painkillers, analgesic and supportive stuff. And then you attempt a diagnosis with the parameters I suggested, and then you carry on. Does cold and hot therapy help? Yes, sir, it does. Cold therapy is advocated for the first 36-48 hours after you have sustained that injury. Apply ice packs. Simplest, a cold water bottle wrapped in a towel, a wet cold water towel, ice rolled in a towel, everything works. When you apply ice, you are preventing that injury to spread. You're limiting that injury. As a result, your travel from injury to health, that travel time decreases. You heal faster. After 48-72 hours have elapsed and the injury has been curtailed, either by intervention or by by the body's alibi, heat application helps dissipate that inflammatory zone faster as compared to non-intervention. Apart from that, once you have diagnosed an issue, then you treat as per the merits of the case. Hypothetically, if it is a disc problem. Now, what is a disc problem? Normally, this is a spine vertebra, another spine vertebra, intervening disc. If you see this yellow structure that is coming out is called as the nerve root. It is a free nerve root coming out. But when there is a bulge in this disc issue, it comes out something like this, a red mark structure. I hope you guys can see it. And this is now preventing the free, it is restricting the freedom of this nerve. So this is with the nerve to irritation of could be in the local back pain, or it could radiate down to wherever this nerve is supplying in the leg, left or right, depending upon which nerve root is irritated. It could be at one level or it could be at multiple levels. So this disc degeneration, which I've tried to show, is the most common cause for lower back pain in elderly and limitation of the range of motion. Conventionally, if the disc is significant and it is not getting relieved in 2 to 3 weeks of time, we do advise a surgical removal of the disc problems. But these days, all said and done, surgery to the back pain has taken a backseat conservative trial and other issues, they are more gaining more significance and acceptance world over. With the permission of the chair, can I play a small video for you about a new technique that we can have without, which can bypass the surgery? It's a 3-minute video. Would you like, would the chair allow me to do that?
Yes, of course, Dr. Dang. Please go ahead. We just give you the rights to share.
Yeah. So I'm just going to play that video on it's a YouTube video, which is an FDA approved procedure, but it is important for you guys to see because this is an alternative to the spine surgery of which traditionally we all have been scared of. It is, just have a look at the video and I'll show you what, I'll tell you what else.
Sure, please go ahead.
Be experienced by people with contained herniated discs, an injury that strikes about 1.5 million Americans each year. Commonly referred to a back. This injury can be accompanied by intense pain in and around the affected disc, as well as in surrounding areas of the lower back and in the legs. These discs, sandwiched between the spinal vertebra, are composed of 2 parts: a hard protective shell called the annulus, and a soft spongy tissue at the center, or nucleus. A healthy disc is like the shock absorber of an automobile, providing a cushion against jolts caused by simple movements like running or jumping. If the annular ring, or the protective shell of the disc, is damaged by injury or weakened by normal aging processes, a portion of the shell can give way to pressure from the spongy nucleus, causing a bulge outward. It is this unnatural bulge or herniation that often causes irritation to surrounding nerve roots in the spine, pain attacks that go with it. Decompressing the nucleus of the disc is a proven technique for relieving disc herniation and for treating the pain symptoms it causes. Disc nucleoplasty is a recent and significant leap forward in disc decompression therapy. Disc nucleoplasty uses a minimally invasive catheter to create an accurate 1 millimeter pathway into the disc. A micro-engineered alloy transmitter is introduced into the disc. Radio wave signals are sent through the transmitter into the jelly-like nucleus of the herniated disc. The radio waves produce a low-temperature ionized gas that breaks up molecular bonds in the spongy nucleus, dissolving tissue volume. When the injection procedure is complete, the transmitter is withdrawn. Full of nucleus tissue relieves pressure on the disc shell, typically allowing the bulge to recede, so the disc no longer irritates the adjacent nerve root. Normally, the entire procedure takes 20 to 30 minutes. The patient is ready to walk out of the clinic in about an hour, with no hospital stay required. Patients are awake throughout the procedure and require only a topical anesthetic and light sedation. Disc nucleoplasty is designed to offer a fast-acting option to drug therapies and steroid injections on the one hand, and a minimally invasive alternative to open surgery on the other. The patented action more closely resembles an ordinary steroid injection than a conventional surgical procedure. Disc nucleoplasty uses an FDA-cleared device to decompress contained herniated discs and treat related pain symptoms. Disc nucleoplasty is a clinically proven treatment with over 10,000 patients treated. The radio wave technology used in disc nucleoplasty was developed by ArthroCare and has been.
So you see that with the passage of time and the need, as we say that need is the mother of all inventions. So with the need, the world has come to a point where we have these minimal invasive techniques for not only for the elderly to restore their range of motion, but even for the youngsters. I treated one badminton player. She's a Delhi state player, and she went back to playing her badminton in less than 3 weeks' time. Procedures like this are available to help us mitigate the sufferings. But again, as they say that prevention is better than cure. So I would be failing in my task if I don't tell you the tips or the ways to stop this back pain or spinal pain from coming. What is the best way to prevent the spine pain or the pain related problems? The best stuff is to exercise regularly. Even if it is a small walk, a small mobility, small stretching, small flexibility exercises, at least, if not 7 out of 7, at least 5 days a week, will keep you more fit and agile and keep these spinal problems and other health issues away. I emphasize exercise, regular exercise is the first step towards a healthy spine. Next comes maintaining optimal weight. As I stressed, obesity is the reason for weakening of the spine if we maintain our weight adequate, in proper bandwidth, eat healthy, eat right, we will be preventing our spinal problems from coming to us. We must sit on ergonomically designed furnitures. For example, allow me another. Chairs like these, they are not ergonomically designed to sit because they have a perpendicular back and our spine is not this thing, it has curvatures. If you see, the lower spine has a curvature like this. The cervical spine will have a curvature like this again, and the middle back has a reverse curvature. So in order to support these curvatures, our sitting arrangements should be appropriately ergonomically designed. I'm trying to show you a chair that I usually use on my sitting area in the office. This back support, augmented back support, keeps my back in the proper position during the long hours that I need to be sitting for my work. So using our ergonomically designed furniture does help us in keeping our back and neck and the back in the right position. As they say, prevention is better than cure. This is a way we can prevent them. We should wear comfortable shoes. High heels are another reason for frequently or long wearing of the high heels are another reason for spine problems. We should not try to deadlift heavy objects because that's a direct strain on the back. Even when we are in the gym, we should be doing supervised weight training. Smoking is a dampener for the spine problems. If I want our spines to be problem-free, smoking and spine problems, they don't go hand in hand. If you smoke, you will have spine problems more likely than if you were not smoking. So these are some of the problems or some of the ways we can mitigate the spine problems. With this, I would conclude by saying today on the occasion of the Spine Day, stay fit, stay mobile, have a healthy spine. Thank you.
Thank you, Dr. Raman. In fact, there are quite a few facts that you've stated were totally unknown to us. I'm sure people in the audience will agree with me that this has been a very, very informative talk. We've already started having questions in the chat. I would also request those people who want to ask questions directly to first announce their name so that we can spotlight them, and then we could have you as our person to ask questions, okay? The first question, Dr. Dang, has come in the chat. Can a coccyx, I don't know if I'm pronouncing that correctly. Is it
yes,
a
you
coccyx? Yeah, okay.
Coccyx.
Coccyx. Broken or damaged?
Coccyx.
Can it be left, or essentially can it be, it needs to be removed? So somebody who has experienced a damaged coccyx wishes to know whether it needs to be removed.
Coccyx is nothing but the tailbone, as I pointed out. Let me just get the model around. So this is our lower spine, the 5 vertebrae. Let me just realign. Okay. Right? So these are the lower bones or the 5 lumbar vertebrae. This is the sacral area of the spine. And this tailbone is called as the coccyx, right? So this is nothing but the tailbone. This is a vestigial organ. This is remnant of the tail that the apes had, and in evolution, if you believe in that, that is left behind in us. So technically, it has got no function at all. It's a vestigial organ. And that's the reason from that big tapes and the monkeys have absolutely no function. But yes, if you have a fracture and it could be either painful or it could not be painful. If you have a damage, there can only be two options: painful or not painful. If it is not painful, leave it. You don't need to do anything at all. If it is painful, you need to start the person on medical therapy as the first line of treatment. If the medical therapy fails, then we give an injection right at the place where the coccyx bone is. And trust me, 50% of the people have relief by a simple articular injection of steroids and their spine problem and the coccyx pain is gone. If it still persists, we do a radio frequency ablation. The similar procedure that I showed you, we do for a disc, is done for this coccyx as well. 90% people after that one ablation are pain-free. It's only a handful of people who require excision of this tailbone, but only if the pain persists, not otherwise.
Thank you, Dr. Dang. The next question has come from Shardaji in Chennai. The question is, low back pain spreading to the right leg. Is it a spine problem?
Yes.
Would you like to elaborate a little on that?
Yes, it is a spine problem. The reason is that there is some discogenic or some compression on one of the nerves. Let's say this is the left nerve. Depending upon which area we are talking about, usually the most common is the L5S1 and the L4-5. So there has to be a small compression which is compressing the nerve or irritating the nerve. And because this nerve is going down on the left side of the leg, that is the reason you're having pain on the left side. So this must be investigated. And the best way to investigate is get an X-ray of the lumbosacral spine along with the MRI of the lumbosacral spine. I'll be happy to help.
Thank you, Dr. Dang. We'll move on to another question. This has been asked by Hemlata ji. Middle back pain with intervals of 2 to 3 months. Please suggest what you would do about it, Dr. Dang.
Middle back pain with an interval
of middle back pain.
3 months.
Yes.
I would like to get her X-rays done and advise her for a lumbosacral belt or an orthoptics to maintain a good posture.
Thank you, Dr. Dang.
We should get an X-ray of the lumbosacral area, AP and lateral. Advise her to wear a belt, especially when she is walking around. Ideally, the belt should not be worn when she's sleeping, eating food, or taking a shower or a daily bath. She should not wear the belt at those 3 times. And other way around, as much as she wears the belt, her posture becomes corrected and she will be better. Please share the X-ray as and when you have it on your hand. I'll be glad to help.
Thank you, Dr. Dang. Jay Lakshmi ji wants to know, is sitting for a long time bad for the back? What about sleeping with a pillow? With or without pillow? What is good for the back?
Sitting for a long time is bad. Yes, she's right on that front. And the reason I have showed, and I'm going to demonstrate again, is most of the times we do not care about the chair that we sit in. You see, there is no lumbar support, no neck support on most of the chairs that we sit in, or the sofa sets that we usually sit on, or the couch that we use. If somebody is involved in a long posture or long time sitting, I recommend these orthoptics chairs. They come pretty cheap these days, and they're practically available everywhere. If they have back related issues, and augmented back support like this one does help. And I'm telling you this not only from my medical, but personal experience as well. What you see is my personal chair that I use for my long sittings. Coming back to the question, second part of a question, does sleeping with a pillow help her back? No, because on pillow lies your head and not your back. So if at all sleeping with the pillow would benefit or damage, it will be to your neck and not to the lower back.
Thank you, Dr. Dang. Would there be any more questions? If yes, could you please unmute yourself, say your name so that we are able to spotlight you?
Excuse me, this is Kumar from Chennai.
Yes, Mr. Kumar.
Hello, sir. How are you doing?
I'm fine. Actually, it was surprising and interesting to listen to you when you were telling that the constipation and the spine are interrelated.
Sorry, come again, sir. I missed the last part.
Constipation and the spine.
Yes, constipation and the spine is the new look at the treatment options.
No, actually even spine problem causes constipation. Was that actually I was just getting from you? Yeah, I was getting from you.
Yes, sir.
Yeah.
Sir, see,
okay, sir.
What is spine and what does it carry? Right?
Okay.
Spine consists of two components: the bony components, what we have been describing, and as I started my lecture, there is this yellow or the nerve component. The yellow component that you see here are the nerves. Where do the nerves start from? The spine starts where the brain ends. So what does the spine do? The primary function of the spine is to carry the nerve fibers from the brain to the distal organs, right to the toe of your foot, or both the toes, or all the tips of your feet, to the distal part of my fingers, to my neck, my shoulders, all the organs of the body. The communication with the brain is through the nerves, and these nerves come in the spinal cord and they exit at appropriate levels, supply them, take their messages back to the brain. So that's how complex it is. Can spine problems cause constipation and bladder involvement problems? Yes. For a simple reason, with the spine problem, the to and fro of the signals going from the tummy bowel area to the brain and back gets affected. It is most commonly seen in the lower spine and above. So any problem can cause constipation because of the fact that the signal transmission to and fro becomes impeded.
Thank you, Dr. Ram.
Thank you. Thank you.
Thank
you.
Thank you.
Can I
Yes.
ask a question?
May I have your name, please?
Rajini Puri.
Yes, Rajni ji.
I have a gap in mid. There is a gap in spine at the middle of my spine, middle portion, and I'm unable to walk more than 5 minutes. So, what? Sir, is there any surgery required, or with medicine it will go up?
Mrs. Puri, am I allowed to ask you some questions before I answer yours?
Yes, please.
Okay. You said there's a gap in your middle back. What level are we talking about? Are you aware of that?
I have seen my X-ray. The middle portion shows some gap.
No. What? What does the report say, please?
Suffering from osteoporosis, that is definitely there. Arthritis, that is also there. But
Okay.
I wanted to walk. That is my
Right. And the second part you said was you can hardly walk for 5 minutes. After that, you have some problems.
I feel tired and I have to sit.
Yeah.
Does
the tiredness?
I get pain in the back.
Mrs. Puri, is when you walk for 5 minutes, does your leg, your calf muscles feel heavy?
Nothing. No.
No. And you just feel tiredness and you have to sit down. When you sit down, does this problem go away, this feeling of heaviness and tiredness?
My back pain and my back pains, and when I sit for 5 minutes again I can walk for 5 minutes.
Yes.
So I get
you are likely suffering from what we call as LCS, or lumbar canal stenosis. What happens is what is a lumbar canal? The lower bone, this spinal canal through which you can see the yellow zone.
Yes.
This becomes narrow. So as a result, the nerves in the spinal canal come under pressure. and they lead to symptoms like yours. So what you must do is you should get yourself evaluated by getting an MRI of the lumbar spine. Once we have the reports, we'll come to know how critical compression you are facing. Based on that, we'll take a call whether we can continue with conservative management or you would require a surgical intervention.
Running for the past 3-4 years, and really I'm in very much trouble.
Nini, Mrs. Puri, I don't deny.
For this,
Sorry, your voice cracked. Could you repeat what you said again, please? Sorry, ma'am.
Puri, we are not able to hear you.
what treatment I should have for this?
Ma'am, you should first undergo a MRI scan for your lumbar spine. This will help us identify the core problem, call whether you will benefit using a medical therapy or you would require some intervention in form of a surgical intervention. I'll be glad to help. Please share your MRI lumbosacral spine.
Yes, definitely. Thank you, doctor.
Yeah.
Hello.
I'd love to see your report and
Can
help
I,
you further.
can
Ma'am.
I say?
Sir.
May I have your name, please?
Yes. This is-
Raghupati,
Give me a
Raghu from
moment,
Chennai.
please. Raghupati ji, please hold on for a moment. There was a
Okay.
lady who wanted to ask a question.
Sure.
Okay. Okay.
Please identify
This is
yourself.
Dr. Krishna Bhatt. I am actually from university. I was teaching in university. Now, one thing is, Dr. Saab, is that when I sit down, I get pain at the back. But it is not a pain. It is actually the warmth. I get the, that garam, garmi ho jati hai bahut. Not pain, garmi ho jati hai. Then I have to get up and I go round. Then I sit. It doesn't give me pain walking, but the moment I sit for a long time, it is very uncomfortable. Number one. Number two, then at times when I have pain, we use that spray. Is that spray good to use? That which gives cooling effect, the spray for the back. Is that good to use?
Dr. Bhatt, that heat sensations or जो गर्माइश आपको महसूस होती है when you sit for long, yes, that is a indicator for early spine issues. I would request that whenever you get a chance, please get your X-ray for the lumbosacral spine done, both in the AP and the lateral directions.
Okay.
Should I repeat if you're writing now?
Yes, I am writing.
Yeah, please. It is X-ray.
Yes. Number?
Capital L/capital S. Spine.
Yes.
X-ray LS spine.
Yes.
In AP.
AP.
A as Apple, P as Punjab.
Yes.
/ lateral, LAT.
LAP.
LAT.
Okay.
London, America, Trombay or Tata.
LAP,
So,
P for Punjab.
LAT, T for Tata.
LAT, T for Tata. Okay.
Right.
LAT.
So
I should get the X-ray done for this. Okay.
Yes, X-ray done for this. 2, if you are sitting in for long, please by yourself or please convert your chair into an ergonomically designed or
Yes,
back support
that
chair.
I have seen.
Yeah.
Is there any name for
Just
this
tell
chair?
them Just tell them to give you an orthoptic lumbar support. Lumbar, which is the lower back, lumbar support chair.
Yes, I liked it. I said we should have it.
I mean, it comes dirt cheap these days. You'll find them all sorts of internet. They're dirt cheap.
Yes. I sit for a long time on my computer. That's why. Then I
Ma'am, you
feel
must.
pain. Then I get.
This will be one investment you will not regret.
Thank you very much, Dr. Saab.
And your
God
third
bless you. Thank
question
you.
was, thank you, ma'am. Your third question was, will application of the spray help you? Yes.
Yes.
It does. Because these sprays have some pain relieving medications in form of
Yes.
sprays and gels. If you
Yes.
use them on your lower, वो नानी माँ की रेत वाली पोटली थी जिसको हम गर्म करके लगा लेते थे, to anything which is let's say a microwavable or electronic or hot water bottle, whatever works for you, whatever you have, they all have the same effect. Please try and use it 2 to 3 times a day when you're sitting on your chair.
Yes. We can keep that at the back and it will be comfortable.
Awesome. Perfect.
Oh, okay. Is it cold or hot?
Hot.
Hot. Okay.
Ji.
Okay.
Thank you, Dr. Dang. That was very informative for quite a few people. I can see in the chat, people are writing
you.
that you are unbelievably empathetic.
Thank
You
you.
explained so very well.
Very
I
nice.
think we will go on to the last question from Raghuji. Could you please unmute yourself? Thank you.
Doctor, very good explanation, everything. We are very much benefited. But my only thing is, this spinal problem is seen in many of the elderly people and all. As far as the accident or some injury is concerned, then going for a surgery and all, okay. But at one stage or another, we get into the pain of the back pain, sitting position and all, walking. But sometimes when you go to that MRI scan and all, it shows multiple days, so many problems and all. Some doctors immediately say, okay, you can have a minor surgery, this. But when I meet my physical family doctors and all, they say, don't go to the surgery at all. Spinal is the most dangerous of surgery. Of course, I say, doctor, I should not talk to you like this. But they say that is the last resort. You should go for spinal touching over because it has got all nervous system. That is the very basic of it. If anybody touches, any nerve can get into disconnected. Like that, many doctors say, don't go. But when surgeon of orthopedic, he says, simple, don't worry, I will do that surgery and all. But to be very frank, at this age, I'm 80 and all. I had at one time, some 2-3 years back, some MRI scan. They said at that time, some constipation, some gastric, all these problems. That all leads to spinal problems, some back pain and all. Then that was Apollo, to be very frank. That doctor said, you better have a surgery. Then immediately another doctor who is very close friend of my relation only, in the same Apollo, no, don't rush it. I will send to another doctor, you go and take it. He said, no, not at all necessary. This you can take some tablets, this, you take rest, you take this, you do it. Like that. Today I am free from any contribution, this and that and all, thanks to Dignity Foundation, so much involvement, activities and all. I forget what my problems and all, I don't feel anything. And at this age, so my sincere thanks is, I think spinal cord is a very, very dangerous one. Surgery should be the last resort. You can tell me all the other sets of walking, reducing the weight, sitting, and that type of chats which we are doing, that all really good. That is what I want to just share with you. Thank you for the operation, but your speech is wonderful. We should take it and see where best we can approach and all. Thank you very much.
Raghuji, thank you so much for your comment. Let's allow Dr. Dang to have the last word.
मैम मैं अपना एक्सरे दिखाना चाहती हूँ डॉक्टर को.
Just a moment, ma'am. Can we please allow Dr. Dang to have? बोल रही हूँ. Yeah, हाँ जी, 2 मिनट रुक जाइए बलजीत जी, अभी आपका क्वेश्चन पूछते हैं. Dr. Dang, what would you like to say to Raghuji about what he shared?
Raghu sir, I absolutely endorse your thought process that where you left, that surgery should always be the last alternative, not only for spine and brain, but for any other problem, ailment that we suffer from. I absolutely endorse it. And this is what I follow for my personal problems as well as the professional issues. Statistically, out of the 98% who suffer from spine problem, only 7 to 8% people require surgery. 90% people will be cured with medication and conservative line of therapy. They do not require surgery. I repeat, they do not require surgery. So choosing a candidate for spine surgery is of utmost importance, and we should exercise utmost restraint only and only if it is necessary. If you would have seen the video that I showed you, that is a bridge between medical therapy / the surgical therapy. That is an FDA certified procedure, which is widely prevalent, insurance approved in US, and it is insurance approved and the panel approved in the country as well. So that is just like getting an injection and coming out relieved. Number 3, about the difficulty of spine surgery. Well, this is where the beauty of the medical education and training lies. If you ask me today to till my garden, or go to a farmland and try and start growing the crops, I would sweat, I would shake in my legs, and I'll not be able to do a good job simply because I'm not trained for it. So people who are not trained for one particular thing should not be condemning or endorsing a particular field or therapy, be it making your chair or furniture making or jewelry making or treating a cough and cold or stuff like that. Personally, I do not other medical problems they come to me with when they come for the spine issues. I'm a spine and brain surgeon. I'm a spine and brain specialist. I confine myself to this particular area. So I'm sure the people you have heard condemning the spine surgeries, I'm sure they were not trained in spine surgery at all. Gone are those days when we used to do exploratory spine surgeries and the results were bad. Today, it is a 1 mm precision that we work with, and with that kind of a precision, you can imagine what the results are. And that is the reason why spine surgery has become so safe.
Thank you.
That's really reassuring to know, Dr. Dang. In fact, somebody has pointed out in the chat, please advise people to avoid quacks who promise instant cure. So maybe Raghuji, that is... बलजीत जी, आप कुछ पूछना चाहते थे, आप अपना क्वेश्चन पूछ सकते हैं। और आपका क्वेश्चन
मैं अपना एक्सरे दिखाना चाहती थी डॉक्टर को, बैक पेन में मेरे प्रॉब्लम जो है।
डॉक्टर डैंग के कांटेक्ट डिटेल्स, उनका क्लिनिक है, हम लोग अपने ऑल इंडिया कोऑर्डिनेटर्स ग्रुप में पोस्ट कर देंगे। आप हमारे कोऑर्डिनेटर्स आपके साथ शेयर करेंगे, एंड हिज डिटेल्स विल बी मेड अवेलेबल. So please allow us now to wrap up the session because we want
last question.
Thank you.
Okay, we'll allow one last question.
Thank you.
Please go ahead.
In meditation, chakra therapy is there. Chakra therapy, which we do, and with the 7 chakras, that simulate our making progress from down up to brain. So this chakra therapy or meditation or yoga exercise, is it good for spine? Is it non-medical?
Meditation is something which helps our mind to be strong. In Punjabi, there's a saying called as "Man jeete jag jeet." So if you have won over your mind, you will win over the world, including yourself. So meditation is helpful. One, it helps us heal faster. It's a proven trick of the trade. So that is the reason, even for other psychological issues and other brain-related issues and any therapy, when you're meditating and strengthening your brain or willpower, it does help heal faster. You pointed out another word called as chakra therapy. Yeah. I am not aware. Yes, I have read on the literature that there are chakras and they control different parts and different energy levels in the body. But because I am not a trained chakra specialist, neither do I have the right to acknowledge nor condemn the chakra therapy. That is something I'm not trained in, sir. So allow me to refrain from either condemning or acknowledging or holding the therapy. Number
physiotherapy will help.
Yoga, we are already. Sorry.
Physiotherapy help कर सकती है, benefit.
I'm coming to that. So, but if we are already suffering from, let's say, hypothetically back pain or cervical issues, and we start yoga therapy unsupervised or undiagnosed, we just conventionally go to a yoga teacher to help us, well, we might land up into having more damage than help. If the problem is there, you need to identify and then find a cure for it. Not empirically, not blind. We might have a jackpot when we play blind in cards, but most of the times we are likely to lose. So risk-benefit ratio does not allow me to advocate doing a yoga mobility exercise the moment you have a back pain or a cervical. My teaching tells me, identify the problem and then find a solution, and then go for the appropriate right remedy. Physiotherapy, again, once you have identified the problem, then only you can know what will help you where. What exercises to be done, what precautions, preventions are needed for XYZ problems.
Thank you so much.
Thank
Dr.
you. Thank you so much, everybody. Thanks for your questions. I'd like to also thank Dr. Dang for the most informative, detailed session that we've ever had on this subject, and for showing us the models of the spinal cord, that along with the video. Thank you so much, Dr. Dang. I found—
Welcome, ma'am. Welcome.
Yes, I found you to be a very, very empathetic person when I met you a couple of months back. And this has been seconded by somebody else also in the chat. We are really grateful and honored that you could join us today. And I'm sure we'll have more sessions from you in the future. As
I look forward to that, ma'am.
Clearly see that people are dying to ask you more questions. Your contact details will be shared with all our members, and hopefully they'll find some remedy, some solutions to the problems that they're experiencing. Thank you so much.
I'll be glad to help.
And have a beautiful Sunday ahead. Bye-bye.
Thank you, ma'am.